Dr. Amie Bend, and I'm demonstrating how to use the fascial device to help my patients that have hip and back issues, tensions in their leg. We've been through some videos prior to, so what I wanted to discuss is the back area and where to roll, and why I like the rolling one versus the non-rolling one for some of my patients, although there are other devices that don't roll that might be a deeper phase of fascial release, and at first we may just want to go lighter, and that's why I'm happy with this for a lot of my patients other than some of the other fascial devices. So what I suggest for patients that are having back pain or rib pain is I want you to put your leg up and then on a chair and then roll the device on your low back, and I like you to get right on the belly of the paraspinal muscle, and you're just going to roll up and down. Now you might find that one side is more tense than the other, and you only want to rub it for just a small period of time, and then you'll want to switch sides and do the other side of the back and get into the belly of the muscle, and it's going to feel sort of painful, so you don't need to spend a lot of time doing it. You just want to do enough to get the circulation going in the area. Again, you may want to also go back and forth and rub it out, but be really light, and then keep an eye on it. If there's a lot of bruising on it, then you may want to back off for a few days. And again, I like to use an Arnica product. Whatever you have at home would be great. It gives you a cold feeling on it that's all good, and it's got great ingredients in it, so it's like all natural. And this may give you some relief with your lower back pain. You may, if you have low back pain, you may also want to make sure you get your hamstring, because a lot of low back patients have actually tight hamstrings, and so you may want to release that. So this is just another way to use your fascial device. I always ask you to be careful. Don't hurt yourself with it. It is going to be slightly painful, so use your common sense and don't hurt yourself with it. Just go easy at first. The expectation is the more you use it, the more circulation that's going to be in the tissue and the less painful it should be, and that also it should not bruise you as much in the future. Now, if you're on blood thinners and a lot of medications, you're going to have to be careful, or may not be advised for this. If you're on some of the more gnarly cholesterol medications and heart medications, you're going to have to be careful. If you know you're getting a lot of blood capillaries and so forth, you're going to have to make sure it's okay with your doctor. So be buyer beware, be using your common sense when you're using these devices, because it does create stimulation, circulation, and it can actually give you some bruises. And I've actually bruised quite a bit from using this on the leg area. However, my arm area doesn't seem to be bruising as much. Maybe it's because it's harder to reach it. I don't really know why, but I do know that it can cause some bruising, and it did cause me to want to buy some Arnica, and I've been using it with the product. So if you have any questions about this, again, use your own common sense, and don't hurt yourself. If you're bruising, stop for a few days and then you can go back to it. But the whole purpose of the product is for you to get better circulation into your limbs so that you feel better. I'm Dr. Amie Bend. My website's Royal Grande Chiropractic, and our phone number is 805-474-4747. Thank you.